Hi guys, so today I'll be talking about mental health and the importance of talking about mental health care. My name is Taylor Knight. So, regarding mental health, there's a lot of stigmas with those with mental disorders, such as being lazy or oversensitive, a negative person, sexually promiscuous, crazy, and it's taboo to talk about these problems. We see in the paparazzi, Britney Spears, Demi Lovato, and Amanda Bynes struggled with mental disorders in front of us on the paparazzi and the major media. So there's three definitions that I found for mental health, and I find this important to shape how we view mental health. It's defined by Google. It's a person's condition with regard to their psychological and emotional well-being. It's defined by Kaiser Permanente. It's your body and your mind are connected. You deserve care that supports your health. And defined by mentalhealth.gov, mental health includes our emotional, psychological, social well-being. It affects how we think, feel, and act. It also determines how we handle stress and relate to others to make choices. This is just important to shape how we feel about mental health care. So, those that receive mental health care may have a common mental health disorder. This includes depression, anxiety, eating disorders, post traumatic stress disorder, bipolar disorder, substance abuse disorder. This is not the entire, this is not representative of the entire list, and not everybody receiving care has to have a mental health disorder. As I see here, I listed two memes, a Lindsay Lohan meme and a meme about disassociation. I find that these memes can be important for those to relate to others when dealing with mental health issues, but it also could be a way of desensitizing ourselves to our mental health disorders and not receiving care because we feel that it's more normal. So those who commonly receive care are young kids, teens and young adults, older adults, veterans, and married couples. Everyone can receive care. There's no age limit. Okay, what impacts mental health? As stated by mentalhealth.gov, it's biological factors, it's life experiences and family history, but mental health issues can come out of nowhere and they can stay forever long, and that's why mental health care and talking about mental health care is important, to preventing it and allowing a safe space to talk about it. Ways to receive care. So under federal law, Medicaid must cover mental and behavioral health services, including substance abuse, as an essential need. Also, major insurances must all cover mental health care with no cost for appointments. There may be costs for medication, but this is a case-to-case basis. There's also therapy apps such as BetterHelp and Talkspace. BetterHelp has a payment plan of $260 per month for unlimited access to a therapist that you choose, which includes FaceTime, messaging, phone calls, etc. They also do offer financial help for those who cannot pay for their own care but do want to receive some. This is good because it's on the go all the time. So there's a myth that those receiving mental health care have a disorder. But mental health treatment is talk therapy, group therapy, nutrition, and medication. It doesn't have to be in this big hospital that people view it as. Mental health care is more preventative work than after work. Mental health care and emotional work is important because those problems leave effects on the physical body. Dr. Mike here, I listed a video. He talks about how he will ask patients that have chronic pain about the stressors in their daily lives. And there he can start to pinpoint maybe these are actually affecting their body rather than an actual physical symptom. So that's why care is important. So how care works, the basics. So prior to appointments, there's an assessment. It's like an online questionnaire or an in-person questionnaire. They make a score based off of your answers, and your therapist will monitor this over time at appointments to see how you're doing and how they're doing as they provide care to you. During care in a session, they would have a discussion of current feelings, why you came, your family background, friend background, and off of this, your therapist will make a judgment of what they're helping you with. Continuing care. It's to be effective, care must happen at least weekly or bi-weekly. And there's also supplemental care such as group therapy, support groups, and psychiatrists. It also could come through nutrition and exercise. It's honestly case by case. Thank you so much for listening. I hope you guys receive care.
Thank you for coming to my TED Talk.
Thanks for coming to my TED Talk.